Hi, this is Victor Cuevas with Victor for Advice, and this is a video that will explain this incredible plan here called the Health Savers Plus Gold Edition. Let me get my glasses here so I can read what I'm doing. Okay, this is a highly customizable plan. You can pick your annual amount of health care that you want to receive that year. You have a lifetime maximum of $5 million. But you can elect to cap your care for that year at $1,500,000 or $250,000. You can pick the benefit level, 1 unit, 2 units, 3 units, and you can pick the deductibles all the way from $100 to $10,000. Now, this is based on Medicare reimbursement. This is an indemnity plan, and it's based on how much Medicare reimbursement you receive. You can receive 3 times Medicare reimbursement rate, 2 times Medicare reimbursement rate, or the Medicare reimbursement rate. What do I mean by that? If I go over here, we see that, let me go to this one here. We see over here, we see a list of all types of procedures. It's not an all-inclusive list, of course, but a lot of the things that happen to people. We have over here on the right side what Medicare actually reimburses for those. So if you had a Medicare plan and you went to a doctor and that accepts Medicare and you had this procedure done, this is what the doctor will receive from Medicare. You wouldn't know anything else because you have a Medicare plan, and that's what the doctor has agreed to because he accepts Medicare. However, if you go to, if you're not in Medicare, under 65, your median price here would be in this column. So let's look at a hip replacement. Median charge nationwide $75,000 for a hip replacement. But if you have private insurance, of course, private insurance have PPO plans. They have networks. They negotiate better prices. And you'd be looking in somewhere in the neighborhood of $44,000 and some change. And back here to Medicare, $20,000. So if you pick the 1 times Medicare plan, you're just going to get what Medicare would reimburse for that procedure. If you get the 2 times, you would get twice this amount with $44,000. And no, let's go with this column. If you get 1 times is this. If you get 2 times, it would be twice as much, $40,972. 3 times as much, $61,458. So if you had a hip replacement and you did indeed were charged $44,000, and you had a Medicare 2 times replacement, you'd have enough money coming to almost cover that charge. And if you had it 3 times, you would have well above what that typical cost for that. Now, built into this plan, and I'm going to explain in a minute, is a program that automatically negotiates the best rates for you through the PPO network. And it's a good possibility that you will probably charge a lot less than $44,000, in which case this 2 times may or may not cover it. But it's a great feature, and I'll explain that in a minute. So now, this gives you an idea when we build the plan out, you know what it means: 2 times Medicare reimbursement or 3 times Medicare reimbursement right here. Okay, so let's move along back to the plans we were at. So here's, again, the benefit level is the 2 times or 3 times or 1 times Medicare. Now let's look at here. Here's the deductibles. Now, it's very interesting to note, and a very, very cool aspect of this plan, that the deductible only applies when you are hospitalized. Anything outside of the hospital you get done through this plan, no deductible applies. This is better than other plans, especially Obamacare, where if you have a $7,500 deductible, you pay everything out of pocket until you hit that deductible. So here we have the deductibles, and it's interesting to note that this aspect here is hospital admission benefit for the first day. So if you have a $5,000 deductible and you're admitted to the hospital, you're going to get a benefit, a payment to you of $2,000, which effectively reduces the deductible to $5,000. To $3,000. If you get the $7,500 deductible, you have a $3,000 coming back to you, which reduces your deductible to $4,500. We'll see how that works here in a minute. But don't be misguided by it as a deductible. Now, if you have $1,000 or less, you're not going to get any benefit at all. Now, let's suppose you go for the 3-unit plan. If you're hospitalized for a sickness, and you see these checks, deductible applies, check, check. It doesn't apply to any of this other stuff I'm going to talk about. It's just to hospitalization. Please remember that. Preferred 3 units. You get 3 units, 3 times Medicare reimbursement. You'll see that explained down here in more detail. But if you're in the hospital for a sickness, you'll get $4,500 a day for the hospital stay. If you get in there for an injury, which over 60% of hospital stays are because of an injury, it's $6,750. If you go 2 times, it's $3,450. Now, is that a good benefit? Well, if I go back to this and I come over here, you see nationwide in different states what hospital stays cost. I live in Alabama. My hospital stays, depending if it's state hospital, nonprofit, or profit hospital, goes from $1,400 to $1,600 and change. You go to California, it goes from $2,100 to $3,800. But you know, nationwide, you're looking at $1,500 to $2,000 for a hospital stay, and up in the $3,000 range on the high end. Okay? Well, if you come back here and we look at a +2, you're looking at $3,000 to $4,500, or preferred $4,500 to $6,750. So you see, these are very, very generous daily hospital benefits here that you get. Now, if you're in an ICU unit, instead of the $3,000 on the +2, on a 2 unit, you'll get $4,500 for sickness and $5,000 for injury, and the 3 unit, you're at $6,775. So you get a significantly higher bump if you end up in an ICU, which could happen if you have a stroke or a massive heart attack. You're in a hospital for 3 or 4 days, 2 days in ICU, you'll get that extra benefit. This is if you end up in a skilled nursing facility for rehab afterwards, $1,500 a day, or $2,250, very nice. And this is if you end up in an outpatient surgery. If you go to the hospital, have surgery, come out the same day, or go to an ambulatory surgical center, you get a $3,500 benefit that day if you're under general anesthesia, or $1,500 if you're not. And that does not include the money you're going to get for the surgery itself. That's basically like a hospital stay. You're not admitted to the hospital, but you have to be there, or you have to be in that facility for that operation. You get that daily fee for that day you're in there. Here's a professional services, inpatient physician care indemnity benefit. I'm going to go right on by that and go to this major one here. These are your surgeries. Surgeries when performed in a hospital or in an ambulatory surgical center. Here's your 2 times and 3 times. Here's where you have a knee surgery that might cost $44,000 and Medicare reimburses $20,000 and some change. Do you want the $40,000 or do you want the $60-something thousand reimbursement? That's where this comes in. So you choose. Now remember, when the concierge service, I'm going to tell you about in a minute, negotiates that price and you get that benefit and it's above what you're supposed to pay for that surgery, you get the difference. It's an indemnity plan. You get a certain amount of money for that and it's yours. And if you paid less for that procedure, you get to keep the money. And when you have a 3-unit plan, that could be a lot of money in your pocket. Then you have the assistant surgeon surgical services benefit for the day, 20%, and then anesthesia benefit. You can go over that in more detail on your own, but a great benefit there. You get doctor visits here. You get 20 doctor visits a year per person. Those include 6 chiropractic, 2 specialists, plus you have a separate specialist here. You get 2 specialist visits a year, $150 a day for specialists, $120 a day for doctor visits. Nice benefit there. Again, remember, all these things I'm telling you about including surgery, has nothing to do with your deductible. The deductible doesn't come into play here. You get coverage on this thing first dollar. Remember that. Inpatient pathology, radiology indemnity, 2 times, 3 times, same Medicare reimbursement. We already went over that. Okay, here back to the physicians. Surgical benefit in physicians, specialist office, get a daily fee for that. Here's your MRIs and CAT scans, very important. $500 or $700, depending if it's 2 times or 3 times, or the 2-unit, 3-unit. Again, we will negotiate these prices down so you can get as close to this daily benefit or even less. You got an X-ray benefit and diagnostic testing, $160 to $240. You got a laboratory indemnity benefit for that every day for labs. Your injection benefit for shots. You get a benefit for being in an emergency room. You get an urgent care. Again, no deductible applies to any of this. Ambulance ride, $1,000 to $2,500 if it's air or ground. Again, no deductible applies to any of this thing. You have a prescription drug benefit for generic and brand name. And you have preventative care here for mammograms, colonoscopies, annual physicals, things like this. Very, very comprehensive plan. And again, deductible only applies if you're hospitalized. Huge benefit over anything else out there. Here's an example of how this may work. Let's suppose you have the 2-unit plan and you have a $2,500 deductible. I would probably go with a $5,000 or $7,500 because of the benefit you get there. But let's suppose you go $2,500 and you have a 2-unit plan and you go into the hospital for 3 days for a covered sickness. Well, right off the bat, you're going to get $1,000. Again, where did that come from? Well, right up here. $2,500 deductible, you go into the hospital, you get $1,000 just for going into the hospital. All right, so we go back down here, $1,000 plus you're in the hospital for 3 days at $3,000 a day for sickness. Remember, it's more for an accident. And that's $9,000. So you take $9,000 and $1,000, you have a $10,000 coming your way. Now you have a deductible for $2,500, remember? That brings it down to $7,500 coming your way. But the 3 days in the hospital ended up being $72, $24 a day. Well, guess what? The $7,500 covers that, plus puts $228 in your pocket. So yes, even though you had a deductible of $2,500 in this case, you didn't have to pay it. Your indemnity plan took care of that and you ended up with some money in your pocket. So if you have that level 3 with that higher daily, you can go to a higher deductible and you end up in a similar situation. Value benefits, this is big here. Again, you have Teladoc. This is huge. Teladoc has been around for many, many years. The top telemedicine company in America. This is used all over the place. Major corporations love this plan. But guess what? Probably 70-80% of what you need to see a doctor for can be taken care of with Teladoc. You get on the phone or video face-to-face with a board-certified physician. You talk to him about your situation. If he has to prescribe medication, he can. Sent directly to your pharmacy. Done with your doctor visit. It doesn't account against your 20. It's free. Here's the PHCS network, biggest in the country. No problem finding doctors and facilities. Here's your Caris 360. This is huge. This is a free benefit to you. They take care of all these neat things for your customer service. They negotiate your prices. You save a ton of money on your health care. The idea is for your indemnity plan to be able to make sure it pays for everything. And hey, you may even get some money back in your pocket. But it's almost like paying with cash. So they are experts. They negotiate the best prices. And you get a prescription discount plan on top of that. Now, to make this even a more fantastic plan, we can bundle it with a specific disease plan here, which is catastrophic. If you have heart attacks, strokes, cancers, angioplasty, coronary, pacemakers, heart valve surgery, amputations, joint replacements, end-stage renal failure, ALS, all these major organ transplants, ruptured aneurysm, all these things that could really rack up, this thing comes into play, and it pays up to $1 million in 1 year, or 500 or 250. You pick the deductibles, 25, 50, 75, and 100,000. Large deductibles, but your plan is going to pay for a lot of things before hospital stays, surgeries, and everything. You'll rack up $30, $40, $50,000 before you ever have to use this plan. So awesome coverage for all these things. Of course, we know accidents are the major reason you end up in a hospital. You have a catastrophic accident, this thing is going to kick in. And again, you can set it up the same way with your year maximum benefit and your deductibles. You put these three together: the accident plan, catastrophic accident, you got this specific disease plan, specified disease plan, and the Health Saver Plus, and you have a rock solid, I mean a rock solid healthcare plan at an extremely reasonable price when you compare it to Obamacare or even some of these group plans that these employers have. Okay, I hope this has been helpful, and any other questions, just let me know and we'll catch you later.